Hello everyone, Happy New Year and welcome to the first episode of CBCLIPS for 2024. In this episode, I present you with a scenario of a neonatal intestinal obstruction in a baby girl born to a diabetic mother. I show you the abdominal films and the contrast enema and I ask you, how would you manage this baby? Let's look at the films. When you look at films in a setting of a neonatal bowel obstruction, there are many things to look at, but what is really helpful is to look at it as proximal versus distal, and as low grade versus high grade. So if we look at these films, we see some distended bowel loops, but there are no significant air fluid levels, and it looks very distal. So essentially, it's a distal low grade bowel obstruction. And for distal low grade bowel obstructions, there really aren't a whole lot of differential diagnosis. There are essentially three: Hirschsprung disease, small left colon, and meconium plug. Meconium plug and small left colon are two entities that are well treated by a contrast enema. This baby has a classic small left colon, and you see a transition zone around the splenic flexure. So in this case, we would do a contrast enema not just with a diagnostic intent, but with a therapeutic intent. And in fact, the contrast enema was done. And following the contrast enema, this baby evacuated a large amount of meconium. So the next question should be, do we have to work this baby up for Hirschsprung disease? Do we do a rectal biopsy? There are two schools of thought. Some do a routine rectal biopsy for all patients with small left colon or meconium plug, but the incidence of Hirschsprung disease is around 10%. I typically will follow these patients closely, and if the patients are not evacuating spontaneously, if they're needing rectal irrigations or any other help to evacuate, I will do a rectal biopsy. This baby did not need anything else other than the contrast enema, and in fact fed and evacuated meconium very well, and was simply observed and diagnosed as a small left colon with no need for a rectal biopsy. The baby still has to be followed to make sure it does not develop unusual constipation in the future, and in fact this was the case. Thank you, and until the next CB Clips.